I genuinely just want people to have the freedom to make decisions for themselves that feel aligned with themselves without feeling manipulated or coerced or bullied or feared into decisions. And right now in the US, I think that's where a lot of parents fall. They just want honest, transparent communication. They're not looking for someone to tell them what to do or not to do when it comes to vaccines. They just want information. And that is
Mhm.
why I was so drawn to you. That's why I reached out and I was like, will you come on the show, please? Let's talk about vitamin K. Can we have a conversation about it? Because I think
Yes.
that vitamin K is a little different than other vaccines because it's not a vaccine, it's a vitamin, right? And so it's got this reputation of being lumped in with other vaccines because it is a newborn procedure and we give it so quickly after birth. Hello, and welcome back to another episode of the Birth Lounge podcast. You guys, every single week I get to hang out with you, and I'm so excited. And this is one of the most exhilarating series I have ever done on the podcast, partly because I always aim to bring you really good evidence-based information, but also partly because this is something that you guys have asked for so long. And I recognize the privilege in that. And truly, I want to say thank you for allowing me to be that safe space that you land when you are making hard decisions in your pregnancy, in your birth, and for your family and your children. Now, before we dive into the episode all about vitamin K, let's talk about the elephant in the room, or shall I say the big baby in the womb. Providers love to throw around this phrase, big baby. We think you're going to have a big baby. Wow, this is a big baby in there. We should schedule your induction because this is a big baby. And you know what? Honestly, it's a great sales tactic because it works. It freaks you out. You start thinking, oh my God, what if this baby's huge? How am I going to ever push a big baby out? But here's the truth. A suspected big baby is actually one of the worst predictors in maternity care. If we actually break down the numbers, only 1% of babies in the US are actually 9 pounds and 15 ounces, which constitutes a big baby. Which means the rest of the 99% of babies that are born in the US are below 915, which means they don't actually meet the criteria for a big baby. So why are you told so much about a big baby? Well, partly because money, like everything, and partly because scheduling an induction or a C-section is easier for the hospital system. And then partly, yes, we're going thirds here, your OBGYN is probably afraid of a big baby. You want another piece of data that may drop your jaw to the absolute floor? The biggest predictor of whether you are able to push out a big baby or not is actually your provider's belief in your ability to do so. Yeah, so the doctor you choose, they're quite important. You want a doctor that is not scared of a big baby, rather knows how to facilitate the birth of a big baby. But what if you don't have that? What if you can't change providers? What if you are too late to maybe go to a different hospital? What if you just don't want to? Then what? Well, lucky for you, I've been working on a brand new course that I'm calling Pushing Out Your Big Ass Baby. And it's going to bust through all the myths, lay out all the real evidence, link all the data for you, and hand you the exact advocacy tools that you need to shut down the scare tactics with confidence. Right now, we are in a pre-sale phase, which means you are getting a pre-sale price. If you have been worried about hearing the words big baby, if your provider has been scaring you about having a big baby, or you're just concerned that you may not know what to do if you run into this in the end of pregnancy, and you're looking for tangible tips to overcome the fear-based rhetoric and actually have the birth of your dreams no matter how much your baby weighs at birth, then this course is for you. I'm going to be defining exactly what microsomia is, whether or not induction and C-section are evidence-based for a quote-unquote big baby, how movement in labor and birth positions make all the difference, the actual risks that are involved because nothing is risk-free, plus we're going to talk about some complications that may arise and how you can handle those, and then finally I'm going to teach you how to advocate for yourself so that you do not get pressured into a birth situation that you absolutely do not want. Head to thebirthlounge.com/bigbaby to get your hands on this brand new course today. Now, right now in the pre-sale period, you will get access to the course, but all of the course content is going to be released on October 15th. Do not wait. The price goes up on November 1st, so get in right now in this pre-sale period so you can take advantage of that pre-sale price. I cannot wait to help you have an empowered birth and push out your big ass baby. Again, that is thebirthlounge.com/bigbaby. See you there. Okay, onward and upward with our vaccine series. Now, one of the most common things that you guys ask me about is the vitamin K injection right after your baby is born. You guys have a ton of questions. Does it come with a black box warning? Is it really necessary? Can you decline it? What is it for? Why do babies need it? Are babies born intentionally with low vitamin K? Can you still get your little boy circumcised if you decline vitamin K? What are the signs of vitamin K deficiency bleeding, and how quickly can it happen after birth? What about alternatives? Are there any? And what kind of risk would you be taking on if you decided not to have the vitamin K shot? Well, lucky enough today, I'm sitting down with Katie Collins, or as you may know her, Katie the PA on Instagram. Katie is a board-certified physician assistant who merges conventional medical training with a holistic mindset, challenging the mainstream narrative surrounding controversial topics like childhood vaccines, pregnancy and birth, and other top chronic health illnesses. One of my favorite parts of following Katie online is that she presents things in a pretty unbiased way. She tells you the pros and the cons, she tells you the risk and the benefits, and then she's going to talk you through your alternatives that you can take back to your provider to have these discussions. Now, of course, it requires you to have a provider that's open to having these discussions and open to meeting you where you're at on this decision-making journey. I also love how much Katie is so in tune with our body's innate healing process, and her first choice of drug, LOL, is diet and exercise. The lifestyle in which you lead is very, very important and super influential on your overall health. This is something Katie talks about all the time. So in today's episode, we are going to dive into all of those questions that you guys ask me all of the time, plus other things like, does breast milk have vitamin K in it? Can the vitamin K injection cause jaundice and high bilirubin levels in your baby? Is there aluminum in the vitamin K injection? What do you need to know about oral vitamin K? Are there differences between the preservative-free and standard vitamin K injection that's offered? And how do you know which one your hospital has? This is truly a discussion about informed consent so that you can understand the benefits and risk and all of the alternatives when it comes to vitamin K in your newborn. So without further ado, Katie, welcome to the show.
Thanks for having me on.
I'm so excited to have you on. Obviously, I'm a little nervous to take on this conversation of vaccines. I was explaining to you when we first met online that it's something that scares me because it gets people really riled up. But as someone who believes so deeply in medical freedom, and I believe so deeply in parental choice and freedom of choice and the freedom that parents should have over making decisions for themselves and their children and their families, I have this nudge in my soul. I have this pull on my heart to provide people with not only evidence-based information about vaccines, but also a true, honest, transparent conversation about alternatives and options and providing them with resources that they can educate themselves and come up with questions to talk to their care team to decide what is the right choice for me. I genuinely just want people to have the freedom to make decisions for themselves that feel aligned with themselves without feeling manipulated or coerced or bullied or feared into decisions. And right now in the US, I think that's where a lot of parents fall. They just want honest, transparent communication. They're not looking for someone to tell them what to do or not to do when it comes to vaccines. They just want information. And that is
Mhm.
why I was so drawn to you. That's why I reached out and I was like, will you come on the show, please? Let's talk about vitamin K. Can we have a conversation about it? Because I think
Yes.
that vitamin K is a little different than other vaccines because it's not a vaccine, it's a vitamin, right? And so it's got this reputation of being lumped in with other vaccines because it is a newborn procedure and we give it so quickly after birth. But we also know that there are questions about it that people have. And so I'm really excited to dive into that today. And I think that a really great place for us to start would be to just define vitamin K in the human system. What do we need it for? What is its purpose? And then why are we giving vitamin K to our newborns? Let's set the stage, and then we can go into the questions that make people a little uncomfortable.
Yes, yes, absolutely. I think that's a great place to start with vitamin K because you're right, it's not a vaccine. It's something that we have naturally in our bodies and we need it to function. And for some reason, newborns are all born naturally low in vitamin K. And so, this intervention that we have with supplementing vitamin K can be useful, but it's something that parents have a lot of questions about, and honestly, providers too. We need to continue to educate ourselves on this intervention that is given to every healthy newborn within the hour that they're born. It's something that we really should know everything about because these babies, this is day one. They're entering the world and then they get a needle in their leg. So it's like, why are we doing this? What is this? Great question. What is vitamin K? So, vitamin K is in two forms, vitamin K1 and vitamin K2. And they have similar uses, but very different. And vitamin K2 is something that is synthesized naturally in the gut after about 2 weeks old. So once the baby's about 2 weeks old, the liver and the digestive system is starting to mature. That gut bacteria is established in the newborn by, through birth, through breastfeeding or formula, whatever you're feeding baby, that's going to establish that gut microbiome. And that is what is going to help starting to synthesize vitamin K2 in the gut. The thing about vitamin K2, we know it can be helpful for clotting in some ways, but it's not as directly involved in clotting as vitamin K1. So vitamin K2 is more helpful for bone health. And then vitamin K1 is what is really crucial in clotting. And that is what we're really concerned about in the newborn because vitamin K deficiency bleeding is a thing that happens to newborns rarely. It's a rare condition where there's not enough vitamin K1 to help begin the clotting cascade and process. And so there's different stages of that. But ultimately what causes death is internal bleeding because there's not enough clotting in the newborn. So vitamin K1 is in the body to help begin the clotting cascade. And the clotting cascade is this series of enzymes and proteins working together to activate factors in the clotting cascade in order to form the clot at the end. So the clot is what we're looking for, and vitamin K is there in order to activate the different enzymes and proteins to make the platelets. Platelets are in the serum in the blood, make the platelets sticky in order to make the clot. So yes, so if you don't have vitamin K, these platelets are then not as sticky and they don't stick together in order to form the clot. The thing about vitamin K1 is we only get it through diet. It's not really present in our body, and it's not formed in the gut like vitamin K2. So that's why we need to supplement or get it from a diet.
What would be the point that babies are born low in vitamin K? It seems as if all babies are born low in vitamin K, that it must be a normal and natural bodily expectation, almost like it was designed that way.
Yes, absolutely. Absolutely. I believe that all babies were born and designed to have low vitamin K in the body. There is some question. Some people will say maybe today babies are lower in vitamin K than they were when we were first created. Is there something that is affecting babies today where they're born naturally lower than vitamin K than they were previously? So that's a question that we could ask. We know since about the 1940s is when, or I guess 1930s is when it was discovered, and then the 1940s is when the injection or oral dosing protocols were created. And so from the early 1930s, that's when we figured out that vitamin K is the thing that makes the platelets sticky. It was actually studied in little chicks and then figured out for newborns. So there's a lot of theories on why we might be naturally low in vitamin K, but they're really not well studied, because once they figured out that, okay, vitamin K is low and that's why there are these newborns dying of bleeding. And it's not like it's happening left and right. It's not a super common condition. Again, it's very rare. There's different stages of it: early, classic, and late. And that depends on the time of birth. Early happens within hours. Classic happens within 2 to 7 days. And late vitamin K deficiency bleeding is the scary one. And that can happen up until the baby's about 6 months. And that's when they're starting to get vitamin K from plant foods. So each of those has their own kind of common statistic, but the main incidence is that this happens in 4 to 7 babies in 100,000. So this is something, even without vitamin K supplementation, is a rare occurrence. But we still don't, it's really not well studied on why vitamin K might be low in newborns, but there are some theories. One theory is that this cord blood is very high in stem cells. And so stem cells are something that help repair all of the little micro traumas that happen during the birthing process, and they can go freely and do their thing. And so that is the thinking of why vitamin K might be low, because if there's a ton of clots happening, then those stem cells can't get to where they're trying to go as easily, because essentially the blood is thicker. So that's a kind of the biggest theory on why that might be happening. But again, it's really not well studied. There's not a lot of data on it, because once they figured out, okay, vitamin K is low, they said, okay, let's supplement. And that was that supplementation implementation was created during a time where there wasn't a ton of clinical trials to determine safety and all of these things. They basically were just like, oh, this helps. And then they enacted it. And then now we're here because they're like, why would we change something that we implemented when we're saving babies' lives? Like, it doesn't matter why vitamin K might be low in newborns, because we're helping save a few babies from this rare condition.
Okay, I want to hang on to that thought and come back to it because I have things going through my head. But before we do that,
Yes.
breast milk has vitamin K in it. So there must be some sort of connection between babies being born low in vitamin K, breast milk having vitamin K, and that serving as the supplementation. Is that wrong, right, kind of on the right track?
So there is vitamin K in breast milk, but such a low amount. In fact, it's in micrograms per liter. Like it's very, very low vitamin K1 coming from mom. Mom can't they have there is a study showing if mom supplements with vitamin K1,
Okay.
she can increase that K1 in her breast milk, but not by much. It's very, very low. So really there's this time period. I mean, the highest incidence of vitamin K deficiency bleeding happens in breastfed babies because of the very low vitamin K in breast milk. And that's even harder because you have moms who want to exclusively breastfeed, and we're thinking it's the perfect food for baby, which it is. I fully believe that. However, we need to recognize that it is so low in vitamin K that this is still a complication that could happen up until the baby's 6 months and when they start eating plant foods, because vitamin K1 is in plant foods. And that's as you're starting to give baby solids, they're starting to get some of that supplemented there. So that, yeah, it's frustrating because you're like, okay, we believe babies coming out and they are designed to survive. And we think breast milk is the perfect nutrition for them. However, it's very low in vitamin K. So this is still a complication that can happen with breastfed babies. And it's much lower in formula fed babies, I will add, because formula has vitamin K supplemented in it. So that's where they figure out, okay, we know if we give oral supplementation of vitamin K, they can be protected against this rare complication.
So would you say that if you have plans to exclusively breastfeed, that it's more important for those families to consider giving the vitamin K supplementation, whether that be the injection or the oral dose? And we'll go into the difference between those in a minute. Just if that's your plan, highly consider the vitamin K.
I would say just recognize your risk for vitamin K deficiency bleeding and know if you're not going to supplement, that's a risk that could happen. Again, it's rare, 4 to 7 babies in 100,000 and that's late vitamin K deficiency bleeding. And that's the one that's the most fatal, with usually characterized by a brain bleed or a bleed in the gut. And it's very sudden. There'll be no symptoms and then they're very sick. And so that's what makes it scary, especially with late vitamin K deficiency bleeding. Classic is usually recognizable by bleeding in the umbilical cord stump or at the circumcision site, and that can be treated. You notice that it's right there. And so you're like, okay, my baby's not clotting. We need to figure this out. And then they're given supplemental vitamin K to make that stop. Early vitamin K deficiency bleeding is also characterized by that brain bleed or the bleed in the gut, and it's also very sudden within hours of birth. We know that the risk of early vitamin K deficiency bleeding is higher in moms who are taking anticoagulants, anticonvulsants during pregnancy. And so it's a little bit easier to mitigate that risk because you know that you're taking medications while you're pregnant.
Sure, it's like an increased risk factor.
Exactly. Yep.
So, what other things might we be doing during the birth process or the labor process? I guess primarily in the hospital system, in more medicalized settings,
Mm.
might be influencing or impacting either low or lower vitamin K since they're already born low in vitamin K. Like
Yes.
things that we're doing that are impacting that process of the vitamin K forming or making them more susceptible to this brain hemorrhage or making them a harder time synthesizing things. Or what do you have to say about that?
That's a great question. I there's honestly not a ton of data
Mm.
supporting any of these increased risk factors, right? Because we've been supplementing for vitamin K since the 40s. So there are theories as to what could be influencing even lower levels of vitamin K today. Back then, there were some really traumatic births. That's when they were using forceps to help bring baby's head out. They were sedating mothers in order to help their labor process. There were a lot of interventions in the 30s and 40s that were questionable on that could be influencing the rates of vitamin K deficiency bleeding. There are some studies that say there is no link between a traumatic birth and low vitamin K because it can happen spontaneously as well, even in a gentle birth. However, it is something historically that could influence that risk. Something else in the birthing process that I think is a good question we should ask is antibiotics in labor.
Mm.
Antibiotics in labor for something like group B strep is something that strips the gut microbiome of the mom as well as the baby. And so when the baby is then trying to synthesize vitamin K2, now we know vitamin K2 is not as helpful in clotting, but we also don't know if it has more of a role than we think. Right now, it's established that K1 is the really crucial one. But if we strip all vitamin K2 as well and make it more difficult to synthesize, how much is that increasing our risk for vitamin K deficiency bleeding? So, antibiotics. Labor, antibiotics given in a C-section, not a vaginal birth. That if I know in C-sections now, maybe you know this better than I do, but aren't they adding some sort of microbiome seeding now? Like you can ask to have a swab of your vagina in order to help baby have a better microbiome in a C-section. Is that something they're doing?
Yeah, you can request it for sure. It's not routine practice. And I would say, actually, there's a lot of people out there who are aware of this data, ask for vaginal seeding, and they face pushback in the hospital system. So it really comes
Interesting.
down, yeah, it really comes down to how open is your provider and your facility. And then obviously, is your C-section scheduled and you are guaranteed your provider that you've had this conversation with, or are you having an unplanned unwanted C-section and you're having surgery done by a surgeon that just happens to be on call when you need your surgery? So that one's tricky. I have high hopes that eventually with all C-sections that will be standard of care because we know that it's so helpful for the baby's microbiome, but that's not standard care right now, which is unfortunate.
Yeah. Absolutely. Yeah, it definitely seems like that should be something that should be researched more and put into practice. Yeah, so antibiotics throughout the whole process, how much is that affecting the baby's vitamin K levels in the end and potentially increasing their risk? So, another risk factor that could potentially be increasing the baby's risk of vitamin K is poor feeding, poor latching, because there is low vitamin K in breast milk. However low it is, that baby's gut, when it comes out, is so ready for whatever is coming in, right? There's no gut bacteria. It's a very permeable gut ready for whatever's coming in. So maybe that low vitamin K that's in breast milk, however low it is, actually what is helping establish that clotting cascade and preventing that vitamin K deficiency bleeding. So even though it is low, how much is that helping? And if the poor latching or poor feeding is affected by that, could be a risk factor that increases vitamin K deficiency bleeding. And we know how many things in the birthing process, that cascade of interventions that could affect poor feeding. Poor latching and poor feeding is a risk factor for things like an epidural, a C-section. So many factors in the birthing process that could affect poor feeding. And that could be then a later risk factor for vitamin K deficiency bleeding.
Naturally, my brain also goes to Pitocin. I'm wondering
Yeah.
if when we give people too much too fast Pitocin, what is that doing to our newborn? And it does, it gets to our newborn. And so we want to ask the questions, not to say that there's certainly a correlation or even an association there, but just now that we're spitballing ideas,
Yeah.
it's in my head about like, what are the effects of Pitocin on our babies. We know that Pitocin increases the risk of hemorrhage in moms. Now, that is a physiological impact because we use too much too fast. Now we have this uterus that is almost like hyper contracting, so contracting too fast, and then it typically leads to what's called uterine atony. So now that uterus is really
Mm.
tired. So now once that baby is born, physiologically, without any interventions, the uterus would still have energy to contract down after your baby is born to help control your bleeding. If we've overused Pitocin, now we have a uterus that is out of energy and it doesn't have the ability to contract down. And so we give you even more Pitocin to help contract that uterus down. And then you just run the risk of hemorrhage because your uterus is sometimes not as receptive to those higher doses of Pitocin postpartum. But it does make me wonder if it's making this hemorrhagic disease maybe a little bit more likely to happen in newborns.
Yeah, you wonder if Pitocin could be affecting the newborn there. What I think about when you think of Pitocin and the increased risk of hemorrhage, if mom is hemorrhaging, then there's less of a chance that they will let them have delayed cord clamping. And delayed cord clamping is something that's really interesting. And it's something that is brought up by a lot of parents because in the 1930s, that was not happening. They would cut the cord immediately. It was definitely not allowed to let baby have their full blood volume coming from that placenta into the cord. And so now a common question I get is that does delayed cord clamping help prevent vitamin K deficiency bleeding? I believe that, first of all, we need to recognize that cord blood is, again, very low in vitamin K. It does not cross from placenta to baby easily. And that's because it's a fat soluble vitamin. So it's stored in mom and she stores it up and it doesn't pass to baby. And so we know that there's low vitamin K in cord blood. But what delayed cord clamping does is it allows baby to get their full blood volume. If you don't have your full blood volume, you have less platelets. And if there's not a lot of vitamin K and there's not a lot of platelets there to make sticky, then the risk could potentially go up if you do it. Now, we can tell the difference between a death by something like thrombocytopenia. That's something we can tell. If they have low platelets, this is their issue. If they have vitamin K deficiency, this is their issue. However, we can ask the question, if baby's not getting their full blood volume, how does that affect the clotting cascade in general? Can vitamin K be affected by that decreased blood volume? And I think that's something that warrants more research. It's something where we know the benefits of delayed cord clamping, and that I believe should be put in standard practice. So I know you probably have a lot of information on delayed cord clamping. Is that something where the delay is long enough? Do you think in standard practice that it's long enough for
No,
no?
I personally don't. And I think the research stands behind that. You see standard across the US 30 to 60 seconds, depending on the facility and the provider attending your labor and also what's going on. You mentioned if you're hemorrhaging, the opportunity for delayed cord clamping might not be there. We know that the World Health Organization across the board recommends 1 to 3 minutes. And then we know that actually the best results that we get is what we call weight to white. And so the placenta has
Mhm.
drained completely. The cord has gone from like a purple blue to a white color. You can tell that the blood is no longer draining and it's no longer pulsing. For anyone out there who has never had a baby and you're preparing for your first, or maybe you have had a baby and you didn't get a chance to necessarily see your cord or your placenta. When your baby is born and they're still connected to your cord is still pulsing. You can literally hold the cord between your fingers and you will feel a heartbeat. And it is your placenta that is pulsing, sending all the blood, which is about 30% at any given time. That placenta is holding about 30% of your baby's blood. And so it takes a few minutes for that placenta to drain all the way and to be able to get that blood back to your baby. I personally, and now I'm just on a tangent, but I personally believe that early cord clamping is a large reason of why we see the risk factor of retained placenta kind of
Mm,
increase, because if your
interesting.
placenta
Yeah.
is still draining and it has not gotten the message that your baby has gotten all of its blood, then that placenta is going to be resistant to separating from you because it believes that it is still keeping your baby alive. And so you have to think that
Yeah.
when you clamp that cord and you cut your baby off, that placenta is now getting feedback that something has blocked that blood flow. It does not know that you've cut the cord on the other side. It just knows that there's a blockage. And so if we
Yeah.
are not allowing that blood to flow all the way out of the placenta, its message that it's getting is something is wrong and I should stay connected because I need to keep this baby alive. And I
Yeah.
have just seen this over the last decade that when people have retained placentas at in labor, okay? I'm talking about immediately postpartum. I'm not talking about your whole placenta has come out and then 7, 10, 15 days later you have a big gush of blood and it has you find that you have a piece of your placenta. I'm talking about your baby is born and within a few minutes we are finding that your placenta is not releasing from your uterus, right? I
Yeah.
believe, and I have seen, and this is anecdotal, so there's no evidence behind this, listeners, but I believe that a lot of that is caused by us disrupting this process of the blood draining from the placenta because your placenta is so intentional. And the placenta actually kicks off your breast milk production, which is called galactogog 3. And so when your placenta drains all the way, your baby gets all the blood, your placenta then can detach, and she's really smart. She knows how to do all of this. She doesn't need tugging. A lot of times she doesn't need cord traction. I think traction is a good tool to have when we need it, but like Pitocin, like induction, like C-section, like everything, one-step delivery, we're overusing it. And so we find that people are tugging on cords when we should really just let her do her thing. She's a really smart
Yeah.
lady. She can figure it out. If you leave that process to do its thing, the placenta should detach all on its own and you shouldn't run into any problems. That was
Well, just to support your anecdote there, really, that happened to me. My first birth,
my
they really tugged on my cord. I really wanted them to wait longer for that cord to be pulsing. And the doctor told me, this is on video, and you can see my face when he said it, that if I don't cut the cord now, the blood will start to rush in the other direction
back to your baby. That's
towards me.
insane. That is insane.
I, you can see the look on my face in the video. I'm like, I'm holding my baby and I'm like, okay. And at that point, the cord was a little bit more pale and they were concerned that I was hemorrhaging. And so they really did a good tug and got it out. And my postpartum recovery with my first was awful. I bled for months. And with my second, I was so clear, and my husband was such a good advocate for me of let's let this cord go. And my bleeding was a fraction of the time. So definitely, again, anecdotal, but happened to me.
Yeah. Yeah, I have 10 years of anecdotal observations that there's something
Yeah,
to this. Not to say that it's the cause or that
right.
it is the reason, but to say I think that we should look into it. And I think that if you
Definitely.
experienced a retained placenta at the time of labor, what did we do with your cord? Is it possible that
Yeah.
we interrupted that process from your placenta to your baby and we confused the placenta and then she didn't know when to release. And then you were subject to other interventions like manual
Right.
removal or
Yeah.
incredibly
Well,
aggressive.
and how much does that, yeah, and how much does that then affect your baby? And going back to these vitamin K levels, when you're wanting that full blood volume there, how, even though it's so little coming from the placenta, how much is that affecting the newborn? That could be what they need to survive and not have this rare condition of vitamin K deficiency bleeding. And I don't think we'll really know the full spectrum of that answer, but it's a good question to ask.
Yeah, definitely. Hopefully, we get some of these answers in the upcoming years, and hopefully, it doesn't take 50 years to get there. Okay,
I know.
I'd love
Yeah.
to talk about the options that we have. So, we have a vitamin K injection, we have the regular kind,
Mhm.
aluminum free kind, and then we have the vitamin K oral drops. And this is something that parents will do at home over the subsequent weeks post birth. Can you talk to us about our different options?
Yes. So, what is FDA approved in the US is the vitamin K injection. It's synthetic vitamin K. There's several different brands that offer this injection. It's usually a 1 milligram injection. However, with some premature newborns, they will choose to do a zero point 0.5 milligram injection. There's still research going on to determine what is the lowest, most effective dose given of vitamin K at the time of birth. But what they've determined over the years is that 1 milligram is good. At first, they were giving 25 to 30 milligrams, and that was actually
Wow.
becoming really, yes, yeah. That was right when it was first coming out. They were supplementing so much that it was causing toxicity, high bilirubin, and that is what caused them to, okay, we really need to decrease the dose here. So that's the vitamin K injection. It's given once at birth. Then you have your oral dosing regimens. Oral dosing is not FDA approved in the United States, which is wild to me because it's all over Europe. It's all over pretty much in any other developed countries. You have the option of doing the oral dosing. There's just none FDA approved in the United States. So you can find brands that offer oral supplemental vitamin K. It has to be K1. There are supplements of vitamin K2 you can give to newborns. That's not what you're looking for. You're looking for supplementing with vitamin K1. And there's different dosing regimens that you can do. What they have found to be the most effective is a 3-dose regimen, 2 milligrams at birth. And there's a couple different 3-dose regimens that you can do depending on the study that you're looking at. But usually 2 milligrams at birth, 1 milligram after between days 2 and 7, and then another milligram between 4 and 6 months. But there are other dosing regimens. One that I think has shown to be the most effective in the data is 2 milligrams at birth and 1 milligram each week for 12 weeks. That's something parents have to consider is, do you want the convenience of the one-time injection versus the oral dosing regimens that you have to remember to give? You also need to, when you're considering the oral dosing, especially as feeding baby, if they spit up, you need to dose them again, and you need to dose them after they eat because the vitamin K is more, it's a fat soluble vitamin, so it does better, it's better as absorbed with food, with breast milk or formula. So that is when you give it, is after they eat. If they spit up, you dose it again. And that is some the parents really have to keep track of depending on how many times they dose, if they're doing the 3-dose regimen or the several doses.
Because you can do the oral dose for weeks after birth, if a parent declines the injection at the time of labor, at the time of birth, and they get home
Mm,
and they realize, crap, I can't keep up with this. It's too much. I've got too much on my plate. I'm missing doses. Can they then go back to their pediatrician and say, "Can I have the vitamin K injection because me doing these doses is just not feasible. I thought I would be able to keep
yeah.
up with it, and now I realize I would rather just have the injection. Is it something that you can have a take backsies on?
Yeah, totally. You can absolutely go to your pediatrician and say, hey, this is too much for me. I can't keep up with this. And you can get the injection. It really is helpful up until the baby's about 12 weeks. And then I guess you're able to get that injection basically up until the baby's 6 months when they're supplementing plant foods. But usually parents realize, okay, I'm missing these doses pretty early on. And so that's something you can change your mind on.
Now, what are the risks with parents who decline altogether? So we don't get the injection and we also are opting not to do the oral vitamin K dose. What are the risks that those parents run?
So, the risk of vitamin K deficiency bleeding changes depending on the stage, but with no vitamin K supplementation in a breastfed newborn, you're looking at between four four to seven babies in 100,000. It's a little bit higher with early vitamin K deficiency bleeding, but we know again that risk goes up if mom is taking medications or if there's any malabsorption issues in mom. So if you have terrible Crohn's or IS and there's maybe something going on with your own vitamin K absorption, or if mom has any liver disease there, that could affect their vitamin K absorption and affect early vitamin K deficiency bleeding. So that risk goes up there. We should make this clear also that oral dosing is not as effective in protecting against early vitamin K deficiency bleeding. So late vitamin K deficiency bleeding and classic is what the oral can do well on. However, those hours after birth, that's when risk is really high for baby if there's no vitamin K supplementation in a mom who's high risk.
Have you heard about the baby soap debacle that happens in the L&D rooms across the US? Well, if you haven't, then let me let you in on a secret. The hospital system often will use something like Johnson & Johnson's baby soap as a lubricant in labor. So remember when we were all little girls and we were told not to put soap in our vaginas because it can throw off the pH, and even now as adult women we're told that we don't need to wash our downstairs lady because she is self-cleaning, she can do it herself. But then in labor they're going to put Johnson & Johnson's of all soaps in your vagina to what? Help your baby be more slippery, which they don't even need. But I understand if you might want a little extra lubrication down there during the pushing period, and I have a much better option for you. Coconut. And if you haven't heard of Coconut, it is one of my favorite lubes. Coconut's products are made with all organic coconut oil, organic coconut water, and other natural ingredients like organic beeswax, organic cocoa butter, organic sunflower oil, and organic shea butter. Because you know what? What you put in and on your body, specifically for your vagina, the details matter. I love that Coconut uses plant-based, non-GMO ingredients, which are also USDA certified organic whenever possible, and their packaging is plastic-free and it's made in the US. Coconut offers oil-based and water-based because if you use toys in the bedroom, you shouldn't be using oil-based lubes with those, only water-based. So they wanted to give you both options, but I gotta be honest, my very favorite product that they offer are the singles. These are single packets that you can literally order a box of, put them in your birth bag, and then if you need extra lubrication during labor, you take the box out, use the single packets. You can use one, you can use all of them that come in the box, and I just love it. I think it is such a better option for you to not only give you that extra lubrication if you want it, but you don't actually need it during labor. It helps you have healthier, better sex during pregnancy because obviously we want to make sure that everything you put in and on your body in pregnancy is organic and safe for you and your baby. And it's much better than Johnson & Johnson baby soap, which is going to disrupt the pH of your vagina. Which, who wants a yeast infection in postpartum? Yuck, not me. What an actual nightmare that would be. So head to coconu.com, that's COCONU.com, and use code HeHe to save 15%. coconu.com, use code HeHe, HeHe, to save 15% and protect the pH of your downstairs kitty. Meow. And what are the signs and symptoms of VKDB?
Great question. Yeah. So in classic vitamin K deficiency bleeding, it's something you can see with bleeding at the umbilical cord site or the circumcision site if you chose to do circumcision. That's typically survivable because you can see it, right? But what's sad about vitamin K deficiency bleeding is baby can be completely healthy and normal, and then within hours you're noticing they're lethargic, they're not eating, they're not opening their eyes, they're not responding, and that is showing you they might have a brain bleed, intracranial hemorrhage, or the bleeding in the gut through internal bleeding there. So it's very sudden and it can be catastrophic. It's fatal for a lot of babies who live through that intracranial hemorrhage will usually be left with some sort of neurological issues because of the brain bleed. Yeah, it's definitely a condition to seriously consider. Although it be rare, we need to realize that even though it's rare, the baby could die. Yeah. That's one of the biggest consequences of vitamin K deficiency bleeding. However, it's interesting talking about vitamin K deficiency bleeding because it is so rare. The way I feel like a lot of providers speak about it is that if you don't give the vitamin K shot, your baby will die. That is what they say to a lot of patients. And I have had patients come to me saying that is hardly ever the case. It's a very rare complication. There are so many other things that your baby could be exposed to that they have a higher risk of death from happening. We have one of the highest maternal and neonatal mortality rates in the United States. And there are several factors that go into that. This is one to consider for sure, but definitely, and because we have something to prevent it easily, then it's definitely something to consider. But it's not as if you don't give the shot, your baby is guaranteed to die. I don't think that should be the attitude when giving informed consent about vitamin K supplementation.
Yeah, I always say that VKDB is very rare, really rare. Mm-hmm. If you are that statistic that does experience it, it can be fatal. And a lot of times it is. And so it's just a risk that you have to consider for yourself and your baby and your family. Are you willing to take the risk to take on that very rare thing happening? But if it's happened to you, it may result in a fatality. And everyone's tolerance is different. And there's no judgment here, you guys. You take on whatever risk you feel most comfortable with, because there's risk too with getting the vitamin K shot. And we'll talk about that in a little bit. I have 2 more questions that I want to talk about the vitamin K. Actually 3 before we go on to those risks. So the first one is circumcision. So if you have a child that needs a circumcision, it must be a little bit more important to get that vitamin K injection, because we know that we're going to be removing that foreskin, and we need your baby to have clotting factors to be able to clot around that wound that we're creating around the penis. Is that correct?
Exactly. Yes. Yeah. And most providers who perform circumcision, who will do that procedure, will either decline doing that procedure if you don't have the vitamin K injection, or they'll have you sign a waiver saying that your risk is much higher because you're getting this circumcision. Your risk for bleeding is higher. There are providers who will allow you to sign the waiver, but will accept oral supplementation. I have found that's less likely, even because it's not FDA approved. But you can find a provider if you're talking about surgical circumcision, that's the process that you go through.
Yeah.
And I make that distinction between surgical circumcision and circumcision done by, say, a mohel or a rabbi. That's a really interesting conversation as well, because usually their technique is less bleeding and less bleeding risk because of the speed of the procedure. Most rabbis will say that they don't require the vitamin K injection because there's very little bleeding with their technique.
Got it. Okay, and the second question I think is about bilirubin. You had mentioned it before, but
Mm.
online, anytime I bring up vitamin K, people always say my only child that struggled with bilirubin was my child that I gave the vitamin K injection to. Help us understand that.
So, again, a very interesting question, and one that you will see differing opinions on depending on the provider. The most conventional providers will tell you that the vitamin K injection does not cause jaundice. And there is research behind that, quite large studies looking at kids who receive the vitamin K injection, oral vitamin K dosing, and no vitamin K supplementation, and their rates of jaundice were very similar throughout all those groups. So there is research behind the vitamin K injection not causing jaundice. However, it's interesting when you're looking at the package insert for vitamin K. It does have, as one of their post-marketing surveillance, high bilirubin or jaundice happening. Now, again, we can't associate causality from the package insert. It's not listing it as a side effect, one of the known side effects of the vitamin K injection. It's just something that was noted in babies who received the vitamin K injection. So again, it's a huge debate. When you look at also the package insert, what I think is really interesting is they don't know the full pharmacokinetics behind the vitamin K injection. Where does that vitamin K go? And their typical answer is that it stays in the arm and then it releases slowly into the body. But then they back that up saying there's no research saying that. There's no research confirming the mechanism that we just described. We're just saying that's our theory. And that's so wild to me. That's on the package insert, and that's also listed in conventional treatment. Another thing the insert says is it'll say it's injected into the arm, it stays in the arm, but then it also says it concentrates in the liver and then dissipates quickly. Again, no research behind that mechanism. I just am like, we don't know. Like, we don't know where this vitamin K goes. We do know that it's protective against vitamin K deficiency bleeding, but vitamin K is stored in the liver. And I think it's pretty reasonable to suggest with our high rate of jaundice, that could potentially be triggering that. Again, more research needs to be done behind it. And I totally agree. I think listening to parents' experience is really important. I value listening to parents who come to me with those stories. However, we can't just set jaundice in the newborn happens around the same time of giving the vitamin K injection. So it's like we can't say the vitamin K caused jaundice because that newborn jaundice does typically happen within the time period that you would say, okay, this is a reaction from the vitamin K shot. But it's something to be said when so many parents have the same story. I do think more research needs to be done.
Yeah, I agree. Okay. On the topic of adverse reactions when it comes to vitamin K.
Yeah.
One of the biggest questions that I get is the black box warning on the vitamin K injection, and parents are so scared to give their child the vitamin K injection because it has a black box warning. What do we need to know about this in order to make a confident and informed decision?
Great question, and one that I get all the time also. So the black box warning is not about specifically the vitamin K ingredient. That is something you need to know. It's one of the ingredients in the injection that is causing this hypersensitivity reaction. And it's in all the brands of it. And it's something where it's one of the ingredients in the vitamin K injection that is associated with this hypersensitivity reaction. It's also really important to know that this typically happens in adults receiving IV vitamin K. There has been one single case of a hypersensitivity reaction happening in a newborn from the vitamin K injection due to the ingredients in it, not the vitamin K itself. So that's something to really keep in mind, that that is a very rare case of hypersensitivity. However, what I think is interesting about that black box warning, and one that I would have questions if I were talking to the AP giving their recommendations, they recommend, the American Academy of Pediatrics recommends an intramuscular injection of vitamin K. However, on the package insert, that's what the black box warning is about, the intramuscular or IV administration. I think more clarity needs to be given on how to best give this vitamin K, and if that administration, the IM administration, is what's necessary. On the package insert, it does say you should use subcutaneous injection into the fat when possible. But again, the American Academy of Pediatrics recommends that intramuscular injection. We know the risk of hypersensitivity is very low. However, I do think more clarity needs to be given on that.
Yeah, I've always understood it as exactly what you said. It is about the dosing as well. So that black box warning does talk about the vitamin K in a large dose versus that 1 milligram that we give to newborns. So I think seeing a black box warning on something that is advised to give to your newborn is really startling. It takes people aback and they're like, oh my God, it has a black box warning. I don't want to give that to my newborn. The way in which we are using it and administering it to newborns is not what the black box warning is warning about. Now, one thing that you said that is so interesting to me is the sub-Q versus the IM, because so many parents don't know the difference. And I would even argue that so many healthcare professionals are giving the vitamin K not sub-Q, rather too deep and actually getting it IM. And I think that can be problematic.
Well, it's how it's recommended though by the American Academy of Pediatrics is IM administration, and that's what the black box warning is about. So that's what's confusing to me. I wonder if the vitamin K supplementation would be as effective if it's given in the way subcutaneous that the package insert actually recommends. I wonder if that is something that we could make healthcare providers aware of and change that wording on the recommendations
from the AAP.
Exactly. Yeah.
Yeah, you can just see that mismatch of what the manufacturer recommends versus what the AAP recommends. And I would love to look into that and see, are we causing problems for babies by the way that we are administering them? That would be so interesting.
I really think that's a great question to ask.
Yeah. Okay. Obviously, anytime that you talk about injections, which I think we established at the beginning of the episode, this is not a vaccine, right? It is a vitamin. But we also know that in order to make anything shelf stable that's going to be produced in large quantities that then have to sit in a doctor's office and be administered incrementally, aluminum is an adjuvant that is put in almost everything that we are given because we need it to be shelf stable. When I talk a lot about vitamin K, I hear a lot of people say, my hospital, my midwife, my facility doesn't offer the aluminum free version. And so this is a big fear. And I think it drives a lot of people to highly consider not getting the vitamin K injection, whereas if they had the opportunity to get the aluminum free version, they might be a little bit more open to it, or at least go into that decision with a little bit more confidence, feeling not so scared about aluminum. Let's break that down very transparently. What do we know about aluminum in injectables? Not necessarily vaccines, because that is not what this is, but just injectables. And what do we know about aluminum and the effects on babies?
Yeah, that is a loaded question for sure. I
I
think one thing,
know.
yeah, no, it's a big one and it needs to be talked about more. And it's really exciting to be a part of a time where we can now have these conversations. I think one thing that needs to be made clear to parents is that vitamin K does not need an adjuvant. Actually, aluminum is not a listed ingredient in the vitamin K injection, no matter what brand you get. However, on the package insert, it does warn about aluminum toxicity. So it's confusing because you're like, okay, it's not a listed ingredient, but I have this warning here. That aluminum contained in the vitamin K injection is minuscule when compared to, say, like the hepatitis B vaccine, which is given at the time of birth. So the vitamin K injection is measured in, you can say 5 micrograms per liter. So think of a big liter of soda. When the hepatitis B injection contains 250 micrograms per dose, that big. That is the difference in the aluminum contained in the vitamin K injection. And I think that's important to make the distinction. The preservative we're concerned about in vitamin K is actually benzyl alcohol. That is something that's the preservative where you can ask for the preservative free. You can get a vitamin K injection that does not contain that. Benzyl alcohol is something, and this is listed on the package insert, where it can cause a thing called gasping syndrome in newborns. And that's when they become metabolically acidotic and it makes it difficult for them to breathe. And so they gasp. And so it's called gasping syndrome. And that is a known side effect from benzyl alcohol toxicity. Again, given in higher doses, that's not in the vitamin K injection, but it does happen. So you can ask for that preservative-free vitamin K injection that does not include the benzyl alcohol. When talking about aluminum is, I think, going to be the make or break it tackle item when it comes to the whole childhood schedule. Because when you talk about the safety of aluminum, you're talking about the safety of the entire childhood vaccine schedule, because most of the vaccines on the childhood schedule contain aluminum. So this is deferring a little bit from the vitamin K injection. Remember, there's very little aluminum in there. However, if you believe aluminum is a neurotoxin, which it is, any aluminum might not be a good thing. And so you need to weigh your risks and benefits when thinking about these medical products, these vaccines that are containing aluminum. In terms of the safety of aluminum, when you start going down this road, you are going to be met with a fork that looks like this. And it's people who say aluminum has no effect. There's no adverse side effects. We should not even be thinking about aluminum anymore because of the form that it's in the vaccine as an aluminum salt. It's not soluble in the body and it's then excreted throughout the urine. The body can do this. Let's shut the door on aluminum. However, if you open the door on aluminum and you recognize aluminum itself is a neurotoxin, and all of the vaccines have doses of aluminum that are higher than the FDA's own limits on aluminum toxicity in newborns, I have questions. I'm sorry. I think that this needs to be studied much more thoroughly with a very clear unvaccinated versus vaccinated study of kids. And there is not one study on the market that is willing to do this. There is no study on the market looking at the effects of aluminum adjuvants with a group of unvaccinated kids, with a group of vaccinated kids, and that needs to happen.
And I can hear the naysayers right now saying that's unethical. You can't withhold vaccines. But here's the thing, and I've said this for many years.
Yeah.
You have a group of people who would voluntarily enter their children in these studies as the unvaccinated because they're not vaccinating regardless. You're not
Right.
withholding vaccines from that population. They
Right.
have consciously and confidently chosen to be a no vaccine family, and they would absolutely volunteer to be in this study.
Yeah.
It is ethical. There's certainly a way that we can use our communities that have chosen to not vaccinate their children as a control group when looking at the vaccine and adverse reactions and even benefits and risk of different vaccines. So I get so frustrated when people are like, you can't withhold vaccines. And I'm like, these parents are totally open to having their child be a control group so that we have a group of kids that are not vaccinated. It, for me, feels very intentional that the FDA, the CDC, these manufacturers don't go out and seek these families out and say, you've chosen not to vaccinate. We'd love to include you in a study. What can we do to help you get in this study as an unvaccinated family? I think it would be nothing. I think these families would say, you don't have to do anything. We're happy to volunteer. We'll volunteer
Yeah.
our children to provide that control group so that we have a group of kids that are truly unvaccinated. And that's different than the placebos that we see used in groups because very rarely are they saline placebos.
Yeah.
They're almost always an older version of that same vaccine, or they are some other vaccine. And so you can't compare an older version with a new version and then say, obviously it's safe. It's safer than the older version, but what about not vaccinating at all?
Yeah. Yeah. I mean, it's the $1,000,000 question.
Yeah.
It's the $1,000,000 question. Do unvaccinated kids do better than vaccinated children? And is aluminum one of those factors that is influencing that? Aluminum in vaccines specifically. We know aluminum is it's all over the place. And so what a lot of people like to, one of the most common arguments I hear is that the safety of aluminum doesn't change when you're eating it versus when it's injected. That to me is unbelievable.
Yeah,
I cannot and the way the study they use to cite that is a computer modeling study. It's not even done in humans. There's also a rabbit study that they cite, and one that uses radioactive aluminum to track it throughout the body, but it's a different form of aluminum than we use. And it's crazy to me that you wouldn't just do the vax-unvax study. There is an ethical way to do this. They know how to do an ethical way to do this. Now, it's not the gold standard double-blind placebo-controlled trial because we will know which kids are not vaccinated, which are vaccinated, but that data is still valuable. You can get good data from a different sort of study when giving informed consent to the families who are deciding not to vaccinate their children. Yeah, I agree with you. It's something where it does feel intentional. And something I do want to bring up is very recently, actually, I think it was like 4 days ago at the time we are filming this in July, there was a new study that came out, a Danish study that studied over 1 million children and looked at specifically if higher doses of aluminum was related to increased chronic disease in kids. And they looked at over 50 chronic diseases, neurodevelopmental issues, autism was one of them. And they determined there's no link. there's no link between autism and chronic disease. If you look, and they include, they're saying with unvaccinated children, there's no link to autism. If you look at their sample, 1.7% of the sample was unvaccinated children. And when you then look at the exclusions that they did, their exclusion criteria of the study, because they'll control for different factors and exclude different kids for different reasons, they exclude most of the kids who were not vaccinated in their final analysis. Or so they're either excluded or they're lumped in to the low dose aluminum group. So the low dose aluminum group got 0 to 1, I think it was 1 or 1.5 milligrams of aluminum over a period of time. And then the higher dose, they did it incrementally by milligrams of aluminum. So 2 milligrams, 3 milligrams, that's our higher doses of aluminum. So the no aluminum kids were lumped in with the low dose aluminum kids, and that blurs the line that we're looking for. Like we're looking for that question, and you have some people there, but you either exclude them or you lump them in. And you have to ask why. Like, why did you do that? Like, why didn't you just study them all by themselves?
Which is so surprising because the Danes usually do a really great job of having like truly ethical studies and like producing results that are much higher quality than the US. And I just have to think that their pharmaceutical industry is just set up very differently. I don't think that their pharmaceutical industry is set up very differently than the US, and that's why I have to think that their studies are typically much higher quality,
Right.
and they're able to give us better data.
And there's a couple of different flaws that critics point out of this study. One of them, which I think is pretty interesting and almost ironic, is that they excluded kids who got more milligrams of aluminum. So I think it was 2 milligrams of aluminum by the time that they're 2, because they determined that would be an implausible amount of aluminum exposure from vaccines in that population. How much aluminum exposure do American children get by the time they're 6 months? That's 3,000, I believe, 300 micrograms of aluminum, translating to over 3 milligrams before the age of 1. So any kid in America would have been excluded from that study because the amount of aluminum that they're exposed to by the time that they're 2 is deemed implausible by the Danes. It's not possible that they would get that much aluminum from vaccines, whereas our kids are getting that day in and day out.
Wow. And we have to consider things like our food sources, our air quality. We just know that so much in the US is tainted because we just don't have great regulations for things.
Yeah. But the FDA has regulations on aluminum exposure in almost every respect. And they have that for adults and for kids, but they still decide that the aluminum exposure in kids, they say that the safety profile does not change between oral ingestion and IM. That they say the safety profile is very similar, when really that mechanism is very, like, we do not know fully the mechanism of what happens when that aluminum goes in the arm. There are some theories though, because so I talked about how they'll say it stays in the arm and it's a slow release over time because it's an insoluble aluminum. And so they say there's some enzymes that will pick that up and excrete it into the urine. That's the main argument for people who say that aluminum is very safe and should not be considered dangerous. However, on the other side of that spectrum, you have studies that show that because the aluminum in vaccines, because they are nanoparticles, they're small, they're smaller than typical aluminum that you're ingesting. It's also bypassing the gut. So the gut has all of these mechanisms to take out toxins in the body, and there's no bypass there. It's completely bypassed in the arm. You inject it in the arm. These molecules are small. They are nanoparticles. So there are some studies suggesting that the white blood cells that rush to the area of the arm once the vaccine is injected, white blood cells rush to the area because aluminum is an adjuvant. They're meant to do that. They say, okay, the immune system, go and attack it. The white blood cells go. The theory goes that they pick up all of that aluminum because it's tiny and it fits them all in the cells and then spread throughout the whole body, including the brain. And there have been autopsy studies showing aluminum deposited in a certain part of the brain. And they believe that is the mechanism by which that they believe the aluminum in the brain in people with neurological issues is caused by vaccine because of the white blood cells that brought it to that area, they're stored in the glial cells in the brain, and that could potentially be causing their neurodevelopmental issues like autism.
Yeah. This is such a rabbit hole. We could just go for hours and hours about aluminum. I think it's something that is on everyone's mind, and I'm really excited that you are tackling this. And I'm excited to have a transparent conversation. I think my last question, and this is something I get all the time on social media, is all right, I vaccinated my child. Now, how do I do a detox? Or is it possible to do a detox to help your child's body kind of move through that aluminum? So, what do you have to say about that?
I think there are some really great companies providing awesome herbal solutions to help with detox. There, again, nothing is really FDA approved in this field. It's not typically studied because if they decide to say that you need to detox from the vaccines that you're getting, then that would suggest that they're not safe and that the metals stay in your body. So I don't think there's a ton of data surrounding these things. However, in adults, when we know if you're talking about mercury detoxing is really helpful if you eat something like cilantro. So you can eat a bunch of cilantro, and that's helpful because that cilantro will bind to that heavy metal and help excrete it from the body. Activated charcoal is something else that can help bind to heavy metals and help you release them from the body. Chlorophyll is another herbal supplement that can be helpful there. And there are a lot of different brands that are offering tinctures of these herbal remedies that can be really helpful for kids. They're dosing them for kids. They're not FDA approved, so I would recommend talking to a naturopath or somebody who I really enjoy the brand Dr. Green Mom because she is a physician and she makes her own products. She makes natal K drops, which are the supplemental vitamin K1 that you can use for oral dosing. That's what I used for my son. And then if you are vaccinating your children, she has a detox tincture that she designed specifically for her own daughter. So you know that is backed by the mind of a physician with the love of a parent in mind. I don't have any links for her. I really enjoy her brand. I know you're familiar with her as well. And she has such great content as well, really great summary articles on everything that we've talked about today, and does offer those detox products that you can give your child if you feel like that they're being affected by the vaccines in an adverse way.
Nice. Oh my gosh, Katie. Honestly, this was such a good conversation. I think so many parents have been craving this information. They've been craving a space that they can ask questions without judgment or being scared that they're going to be manipulated or coerced or told that they're a bad parent for even thinking these things, even bringing this stuff, even being curious about the decisions that they're making about their child's health care. So I just want to extend a really warm thank you to you for coming on the show, being so open with this conversation, and sharing so openly with parents about the things that they can consider when making these decisions. So thank you so much. If people wanted to learn from you or connect with you or take advantage of any of the resources that you share, how can they do that?
Thank you so much for having me on HeHe. This has just been so fun, such a fun conversation. And I thank you for opening up this door for this conversation. Parents, like you said, are craving this information. You can get a hold of me primarily through my Instagram, kdc.pac. However, I will be opening up a website where I can start to take some consults for people per month. So if you do want to have a one-on-one discussion with me, I'll have a platform where you can do that as well. That hasn't happened yet, but we are developing that right now. But primarily kdc.pac. I am the one who answers those DMs. I have been receiving so many amazing DMs from parents with questions. I can't give medical advice, but I do try to help provide information that can help with any decision that you're trying to make. Yeah, kdc.pac.
Nice. I love that. Again, Katie, thank you so much. And listeners, wow, what a conversation, you guys. This is a space that you are safe. You can ask anything. I will never judge you. I will never think less of you as a parent. Matter of fact, you asking the hard questions shows me just how much you care about your baby and your children and your diligence in making these decisions. I know that so many parents have these questions because you're scared to make the wrong decision. I know it comes from a place of you genuinely just want to make the right decision for your child. So I'm here to share with you that if you're asking these questions, please know that you're doing the right thing. Your curiosity is welcomed here. I love it. I love being able to provide you with this space to ask these questions and to get transparent, honest, evidence-based information about all the things that you are making decisions about for your baby and yourself and your family. All right, you guys, I will see you in the next episode. Be sure to follow Katie on social media, and you can find me at Tranquility by HeHe and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm HeHe, and this is the Birth Lounge Podcast.